I just did 2 bilateral deeps and 2 bilateral tissue expanders for patients. And I've never had this happen before, but during the second deep, I got a phone call into the operating room saying that United Healthcare wanted me to call them about one of the patients who was having surgery today, who was actually asleep having surgery. And, said I had to call right now. And the gentleman said he needed some information about her, wanted to know her diagnosis and whether her inpatient stay should be justified. And I was like, do you understand that she's asleep right now? And she has breast cancer. And the gentleman said, actually, I don't. That's a different department that would know that information.
Yeah, so calling to potentially reject the ability for a patient currently undergoing surgery for cancer to stay overnight and not even being aware of the condition of that patient. This is United Healthcare. It's been in the news recently. I don't know if you've been aware of that, and no changes seem to have been made after the horrible cold-blooded murder of their CEO. Not that that should have ever happened, but even that seems to have not added any sort of compassion or change in policy to a company known for brutally rejecting people's claims. That was Texas Dr. Elizabeth Potter posting that on TikTok just 2 days ago. Another example also of how our broken healthcare system fails the American public. So there's more I'd like to talk about in a moment, but what do we make of just that part of this insane story? Because it's pretty sickening to me. Jordan?
I mean, how many more of these stories do we need to see for there to be a national, sweeping, and unignorable movement for a universal care system? Like, does anybody see that and be like, yeah, that's the way things should be? That a surgery potentially could be stopped by a health insurer midway through the procedure. Does that seem normal or acceptable to anybody? And only to people who stand to benefit or profit from it does it make sense. But people, their healthcare, their lives, their well-being, and their futures should not be a line item in a budget. So I hope we are getting closer. Unfortunately, it does not seem like we are anytime soon, but I hope that moments like these and stories like these, and sadly, the killing of the United CEO, triggering a national conversation about how predatory the health insurance industry is in this country, maybe it's things like that that will be the catalyst. It shouldn't have to be like that. We shouldn't have to reach that kind of a point, but every other developed country has universal care, and we should be among them.
I think it was pretty striking. Just the idea that no, I didn't know that information. We have another department for that because of what that says about how large the private health insurance industry really is and how much it costs to operate these businesses. You know, you have these multiple departments where they delegate all this information and people are paying their bills, their mortgages, raising families off of this, which really highlights to me the biggest obstacle in terms of us getting to any type of single payer system. That obviously that's ideal, but when you have a whole entire industry that millions of people again raise their families on, how do you just get rid of that? It's so baked into the system at this point that that seems to be just the biggest obstacle to me. I mean, where do these people transition into? What other field are they going to go into? But at the end of the day, it's just an unnecessary industry. We don't need it. But again, it just when they were like, "Oh, we have another department for that." I don't need to think about those types of things. Like so much money is being spent that could just be spent better. We know that our system that we have now wastes a ton of money. But again, what do you do when millions of people pay their bills like this?
Yeah, and it's also just a system that is so indicative. It's such a horribly great example of who really our government truly at the end of the day cares about. Because just the simple fact, even take the example of how only recently under the Biden administration is the government allowed to negotiate drug prices to lower them Only for 1 or 2 drugs is this now allowed. What do you mean? You're the United States government, you're the biggest economy in the world. You can dictate right now that you're allowed to negotiate every drug price. Otherwise, you drop those companies and never work with them. And they would have no choice but to capitulate to that. And they just don't want to do it. When I ran for office, it was the most eye-opening thing. Everybody's biggest concern, almost everybody, the concern I heard the most often was healthcare, was my husband is sick, my wife is sick, and we don't have proper coverage, and we're afraid it's going to bankrupt us. I'm stuck in a job that I hate that doesn't pay me enough, but I'm afraid to lose my health care because I won't be able to afford if I go elsewhere, or I will lose it in the middle of a treatment. It's unconscionable. It's disgusting. We like to say that we're the best country in the world, even though on so many metrics, we are so far down the totem pole as far as rankings, as far as education, as far as healthcare. We're just number one in confidence, as I've said many times. We're the goat of confidence, and that makes us think we're number one, and it makes us not take a critical eye to actually make changes in policies that we dearly and urgently need. Let's talk about prosthetic limbs for a minute, something that often is denied to people. There are so many stories of how Americans are getting screwed in many ways. This is one of them. Recent reports have revealed that amputees are often denied prosthetic limbs by insurance companies. I'll tell you why in a second, but first you should know a couple of statistics. An estimated 2.3 million people are living with limb loss in the United States, according to an analysis by Avalier, a healthcare consulting company. Fewer than half of people with limb loss have been prescribed a prosthesis, according to a report by the Federal Agency for Healthcare Research and Quality. An October report by the Government Accountability Office found that only 30% of beneficiaries who lost a limb in 2016 received a prosthesis in the following 3 years. That's just unacceptable. That's insanity. Amputees and their advocates argue that that amounts to discrimination because healthcare companies approve joint replacements at far higher rates. So how do you justify it? It's arbitrary, and you're being arbitrary with people's lives and their ability to lead healthy, full lives that can change their entire existence, their mental state. Losing a limb doesn't have to be something that even drastically changes your ability to do most things unless you don't get that prosthetic limb. A dear friend of mine is the Olympian Amy Purdy, who is a double amputee and has 2 prosthetic limbs and is an incredible athlete. And you can go to the sky and beyond being the limit if you get the health care you need. And we're in a country that denies people of that. Jeffrey Kane, a family physician and former chair of the board of the Amputee Coalition, stated, insurance covers a knee replacement if it's covered with skin, but if it's covered with plastic, it's not going to cover it. Where do you get those arbitrary lines from? And Kane, by the way,
is evil.
It's complete evil. It's insane.
Evil.
Why do insurance companies cover prosthetics so infrequently, by the way? Plans may deny coverage for prosthetic limbs by claiming they aren't medically necessary or are experimental devices. If you don't have legs, I'm pretty sure you're down to experiment with a leg that they hand you. Even if it's not super well yet tested, you can then just get another one, try a different solution. Michael Adams, who lost his leg to cancer when he was a child, has used a prosthetic leg with a microprocessor-controlled knee for years. But when he switched health insurance plans, like I was mentioning a minute ago, and requested a replacement, his insurance plan would not cover it. The roughly $50,000 leg with the electronically controlled knee wasn't medically necessary, the insurer said, even though Colorado law leaves that determination up to the patient's doctor. And Adams has prescribed a version of that leg for many years, starting when he had employer-sponsored coverage. Quote, the electronic prosthetic knee is life-changing, said Adams, who lives in Lafayette, Colorado with his wife and 2 kids. Without it, it would be like going back to having a wooden leg like I did when I was a kid. It's fully insane. Jordan, it sounds like you have something to say.
Oh, I just I can't believe this. It is the purest distillation of the profit motive in healthcare because, like you're saying, it's ludicrous to suggest that people who are amputees don't have a medical necessity for a prosthetic. Like, what are we doing here? And the only reason they would deny that is not for experimental devices or whatever their rationale was. It's just that it's just all cost for the insurer. And they're fine discriminating against people who are amputees. Like what? How can any moral or sane person look at that and be like, yeah, that's wonderful. We should do that. Only 30% of people who are missing a limb or multiple limbs should get prosthetics. It's just disgusting. Absolutely disgusting.
And to think that the way they make their profit is, how can we deny? How can we? I mean, that again, that's how do you sleep at night if you're on it and on the executive board and you're making these types of decisions? Basically, it's getting down to, well, can they technically survive without their appendix? Well, yeah, so we're not going to pay for them to get it removed. Can they technically survive without some type of prosthetic limb? Well, yeah, their heart's still going to be beating, their liver's still going to be functioning. Ain't nothing wrong with their kidneys, so charge them for it. And that's the only way they really can make additional money, because at the end of the day, there's just some things that profit shouldn't be in the center of, because it doesn't make sense for it to be in the center of it. It's totally fine if, like, okay, last year we made $20 million selling this pair of sneakers. This year we want to see if we can make $35 million selling a couple of other things within the brand line. At least it's a product. You're giving people something that they'd like to purchase. Maybe you can have outreach programs of various sorts to where people want to be involved with your business, your entity, and your brand. But this just isn't one of those things. People don't use health insurance unless they have to use it, unless they get hurt, unless they get sick. That's when they're using it. And these organizations collect untold amounts of money, and then when it's time for you to get help, they're like, nah, sorry, we can't help you. Took tens of thousands of dollars from you, but.
Thanks for watching The Young Turks. We really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat emojis, badges. You've got emojis of me, Anna, John, JR. So those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.